Food deserts, as defined by the USDA, are parts of the country vapid of fresh fruit, vegetables, and other healthful whole foods usually found in impoverished areas. Instead of supermarkets and grocery stores, these communities may have no food access or are served only by fast food restaurants and convenience stores that offer few healthy, affordable food options. The lack of access contributes to a poor diet and can lead to higher levels of obesity and other diet-related diseases such as diabetes and heart disease. The food desert problem has become such an issue that the USDA has outlined a map of our nation's food deserts.
Across Virginia, approximately 17.8% of the population lives in a food desert.
We're here suffering. All we ask is that you listen to us.
I think that all of us can take some responsibility for not being as sensitive.
I don't like it. They should at least have one grocery store in this area that is a grocery store, not a damn junk store.
It's eye-opening that there's that much need.
No fresh produce, 3 miles.
Keeps me up at night. The thought, the idea that children are going to bed hungry.
These people here are really hurting, and they're hurting bad. And not only they're hurting, they're hungry.
More and more we're seeing what a complex problem it is in these low-access, low-income communities.
Ultimately, if you continue to eat cheap and unhealthy food, it's going to lead to poor health, it's going to lead to obesity, it's going to lead to a lot of the diseases such as high blood pressure.
We have a location just here in our neighborhood that was a grocery store. It's now a dialysis center. And it tells the story. This is what happens when food access moves out, lack of health moves in.
Last year, the food banks in Virginia actually distributed over 142 million pounds of food and grocery products.
The governor and I are very concerned about the fact that in Virginia there are over 300,000 food insecure Virginia children, and that's just not a place that we want to be as a Commonwealth.
It's so important these children get all the food they can handle and need.
This is not only a local problem, this is a global problem, this is an epidemic.
Food deserts are most commonly found in communities of color and low-income areas where many people don't have cars. Studies have found that wealthy districts have 3 times as many supermarkets as poor ones do, that white neighborhoods contain an average of 4 times as many supermarkets as predominantly black ones do, and that grocery stores in African American communities are usually smaller with less selection. Public awareness of the formidable problems posed by food deserts is growing, thanks largely to the efforts of community activists, entrepreneurs, and government officials committed to increasing people's access to healthy food options. On the national level, First Lady Michelle Obama has spearheaded the Let's Move campaign to combat childhood obesity, which includes a goal of eradicating food deserts by 2017 with a $400 million investment from the government focused on providing tax breaks to supermarkets that open in food deserts. Many urban areas are also implementing initiatives locally to solve their food desert challenges.
Right now, there are 23.5 million Americans, including 6.5 million children, who live in what we call food deserts, in the inner city and in rural communities.
Lots of different definitions of food deserts, but most people basically say it's a place where there is not access, easy access, affordable access, reasonable access to fresh fruit, vegetables to a grocery store.
You see a preponderance, for example, of convenience stores and fast food restaurants, but very little healthy food options for those residents.
We are at the Fair Hill Elementary School in Philadelphia. We're focused on a tremendous program that they have here to reduce childhood obesity in this school and also to encourage fresh food and healthy eating.
Our goal is ambitious. It's to eliminate food deserts in America completely in 7 years. Tackling the issue of accessibility and affordability is key to achieving the overall goal of solving childhood obesity in this generation. And we saw this example today during our visit to the Fresh Grocer at Progress Plaza. The last supermarket that was in that community closed more than 10 years ago. There were kids in that community who couldn't get the nutritious food that they needed during some of the most formative years of their lives. This is happening all across the country. We're setting people up for failure if we don't fix this. With a modest initial investment of about $400 million a year, we're going to use that money to leverage hundreds of millions of more from private and nonprofit sectors to bring grocery stores and other healthy food retailers to underserved communities all across this country. If you can do it here, we can do it around the country. So let's move. That's really the point. If we know it can be done, let's move, let's get it done. Let's give our kids everything they need and everything they deserve to be the best that they can be. Thank you so much.
Although there have been many programs put in place, the problem of food deserts has not been solved as yet. You can help by collecting food outside your supermarket for a local food bank or by simply spreading awareness.